So my name is Jacob Tas. I'm the CEO of the KNRM. That's the search and rescue organization in the Netherlands. Yeah, mental health and well-being of our volunteers that go out to sea to help and rescue people is essential. And why is it essential? Because our volunteers are faced with tragic events, difficult events. Sometimes they have not been successful in the ability to save somebody. So it will be people who have passed away that they need to capture, and then other things. There's also just the events and the scene of the incidents is of a nature that we really need to make sure that we look after our staff so that they're effective in the work they do, but particularly also that they're happy when they come back and that they can continue to support us in our work. The unique challenges, I think, are that the work that we do is sometimes people are confronted with painful and distressing situations. So that could be somebody who willingly wants to commit suicide that we try to help. It might be that help is too late. It might be that we're dealing with family members who are looking for the victim as we do, but therefore are interfering. So it's, I think, not only stressful, but it's really a strain on our ability to work harmoniously. And we need to make sure that the work we do, which we're very proud of, we can continue to do. So at the KNRM, we invest quite a lot in how we support our teams, because we train volunteers at each of our lifeboat stations to monitor the group, and at all stages look for signs of distress, mental health or well-being issues. And then we have coping mechanisms, of which the main one is that we en group talk with each other about the experiences that people have had. And that's usually a very effective way. Also, we then keep on following up the next day and the day after, if people feel okay, if they've slept well. And one of the main signs is there anything unusual in the behavior of that person. Those are the first signs of issues around well-being and mental health. I think that it's really important that the IMRF is putting an emphasis on this. I think for years in the Netherlands at the KNRM we've been working on it, realizing it, and also what I described earlier about our approach. We have also engaged with a professional trauma organization that is 24/7 at call out for us to, in case individuals from the KNRM would request that support, their professional psychologists that are trained specifically in trauma to support them. And this has all been started, I think, around 15 years ago when there was a big crash of an aircraft in the north of the country, and which was very tragic and very impactful on the volunteers. And we realized that we really needed to invest in that. So that's right across the country that we have done that.